Parents, this is a mind-blowing and really a staggering statistic. 80% of children born via C-section end up diagnosed with sensory processing disorder. Now, before we go any further, let's explain what is sensory processing disorder, right? If you have a kid struggling with that, maybe you're already familiar, or maybe you don't know that things like struggling with different textures on clothes or foods, maybe sounds that can set kids off, or different changes in your atmosphere or your experience day-to-day life, bright lights. When those things are really easily setting off a kid, this is really what's at the root of it. It's this sensory processing disorder. And that is really connected to so many other neurodevelopmental challenges, stuff like autism or ADHD, emotional regulation, behavioral things, sensory challenges. It's really at the root of all of those. It's kind of the underlying missing piece that leads to all those other symptoms and challenges. So let's take a minute to talk about that. Why is this connected, right? What in the world does birth have to do with sensory challenges? How can that affect your child? And then what can we do about it to make a different path or different future for them? Because this is something that is overwhelmingly common, right? If we have 35% of births, sometimes even more than that are ending in C-section, the number of kids dealing with those sensory challenges is through the roof. And we see all of those statistics keep going up year after year, right? The autism rates are up to 1 in 36, and we've got to figure out what is going on with our kids and how can we address that. So, like I said, this is at the root of most of these other neurodevelopmental challenges because it's really the underlying foundation of why we are struggling with different outputs, right? I want you to think about this in a different way. We usually are thinking about the outputs, and what I mean by that is the behaviors that a kid is struggling with. And that could be a behavior in the sense of they're acting out, there's a tantrum, or maybe it's a behavior that's not happening, right? Like communication, they're not speaking, they're not verbalizing. There's some sort of output that we're concerned with, either as parents, providers, therapists. But that shouldn't be our focus because those outputs are only a result of the input that our nervous system is taking in. And that's where the sensory piece of it is really key. Because our nervous system first takes in information, right? It's perceiving everything going on around us, and then it has to process and integrate all of that information before there's an output. So if we have negative sensory input coming in, there's zero chance of the right output coming back on the other end of that. So when we get to the bottom of that equation, it's not about addressing the output. It's not about changing behaviors or different therapies on that sense. Yes, those can be helpful, but if you just focus on that without ever changing the input, you're never going to get to the bottom of it, and it's going to be an uphill struggle, honestly. So let's explain this a little bit more. Well, how does that brain and body get dysregulated and disconnected? That is really what I would describe this as. Sensory processing challenges is a brain and body that aren't communicating well. It's the actual environment around them, the actual experiences that kid is having aren't what they feel like they are experiencing, right? The texture differences on their clothes or the weird food or the sounds, instead of just being a little bit of extra noise in their environment, it is overwhelming that internal input. And that's because when they are at rest, their baseline is already really ramped up. That's what we see going on. That is the key with sensory challenged kiddos, is that their baseline is through the roof to begin with. So if you're already at an 8, 9 out of 10, it doesn't take a whole lot more extra input or extra stress to push you over the edge and have you reach that tipping point. What our nervous system is always doing is taking in information. And if everything is working as it should, that's a good process, right? It's this fancy word called proprioception. It's really our brain's food. Our brain needs to be taking in info, needs to be taking in that sensory input all the time. When that's working well, awesome. When we don't have that proper input is when this stress cycle happens and takes place. Now, the majority of that proprioceptive sensory input is coming from your spine, right? It's coming from this core part of your body because neurologically, that's what your brain needs to have as the priority, right? If your brain knows where it is, everything else is connected to that. So majority of the sensory input coming from that core center operating system. And even if we hone in on that even more, the majority of that part is just coming from these first couple of areas, your occiput, the base of your skull, the first couple of cervical vertebrae. And that is because your nervous system so highly prioritizes where you are in space from a walking on 2 feet perspective, right? We need to keep our eyes level with the horizon. We need to have that sense of balance that is extremely complex just to be able to figure out how to walk and how to stay upright. So since that is the most important sensory rich information, that is the biggest opportunity for things to go awry. And that is really the birth connection, right? That is why something like a C-section or other birth trauma, forceps, vacuum extraction, or just the doctor's hands pulling, turning, twisting at that head and neck, everything in those scenarios has the same underlying theme. It's that upper neck is damaged, right? If you pull a baby out by the head and neck during that birth process, these first couple areas are going to get stuck. They're not going to be moving as well as they should, and there's going to be so many consequences from that, which eventually shows up as sensory. As a side note, early on, that's going to cause issues too, right? You're going to have a kid that maybe struggles to latch or has a preference side to side. They're often dealing with more fussiness. They're struggling to sleep, a little bit colicky, they're refluxy, they're spitting up a little more, sometimes constipated. There's going to be other early life challenges that then usually shows up as they grow as maybe ear infections or torticollis or needing a helmet and some other stuff before they get old enough, 2-3 years old, where it starts showing up as the sensory stuff too. So that's a whole cascade, right? It's not like this is coming out of nowhere down the road. We see that journey having the same underlying steps over and over again. And so what's going on is the busy internal overstimulated nervous system can't process and can't handle anything else, and that's what pushes them over the edge. The other huge part and huge connection to that upper neck ties into what's called our autonomic nervous system, or what we call and talk about at Thrive as your gas pedal versus your brake pedal, or your stress response versus your wellness, rest, and digest mode. That is primarily run through the vagus nerve, a nerve at the very top of the neck here. So when that is affected through that early life trauma or intervention, now we not only have an overstimulated, overwhelmed nervous system, we have one that is shifted more into fight or flight, shifted more into stress and survival mode. If we get locked in stress, that brake pedal, our wellness, rest, relaxation, growth, and development, all that gets put on the back burner and nothing else matters. So that balance, that dynamic is everything, gas pedal versus brake pedal. If we have a busy, overwhelmed sensory input, we have zero chance of regulating any of that on the other side of it. The good news though, right, this is all doom and gloom. The good news is that is exactly what pediatric chiropractic is for. One, we have to assess that, right, and see, is that what's going on with your baby, with your toddler, with your 6-year-old, however old that kid is? And if that is at the root of it, what do we do to address that? How we find it is our scans. We have several different neurological scans that have zero radiation. They're non-invasive. It's a super easy way to assess how is your kid functioning, right? What is that brain and body connection looking like? Do they have that ramped up, overwhelmed sensory input, or are they handling stress, handling life okay? So we figure out what's going on, and then we use that to map out what is that game plan? What does that care plan need to look like for your kid? So we normalize the sensory input so we can regulate and calm the outputs and the behaviors so they can be having the normal experiences, so that you can go to the birthday parties without having the meltdown, so that you can wear the clothes that are appropriate for that environment, or anything else that you can imagine for your kid struggling, right? We've seen so many stories of kids dealing with those exact challenges. They won't get off mom's lap, they can't handle the environment, they can't lay on the table, to being able to crush it and thrive in everyday life. So that's what we want for your kid. If that sounds like what might be going on, if you had some of those early warning signs, let's find out how your kid's system is working, right? Let's schedule their scans. Let's actually measure and track that neurological connection. And if you just want to dig into this and learn more and you're a science nerd like me and you want to get all the details, join us at our next workshop, November 14th, here in Cranberry at the Sports Grill. We're hosting a live Perfect Storm workshop where we're going to go through all of this science in way more detail and put together the game plan and explain how is it that so many kids are struggling, and most importantly, what can you do to help. So register at the link on our page in the bio here. Join us at that workshop, schedule your kid for that initial scan, and I cannot wait to meet them soon and help your family thrive.